Hello everyone. Welcome to Enzyme MBBS, where complex medicine becomes simple and exam ready. Okay, so without wasting any time, let's get started. So first start with the definition. Now many of you may thinking of a tabular column because the question is difference. But when a difference question is asked for 5 marks, only tabular column doesn't yield you marks. That's why even in the thumbnail we write like a topper. So this is how we gonna start with the definition. So exudate, it is a protein rich inflammatory fluid that escapes from blood vessels due to increased vascular permeability. Obviously in inflammation, vasodilation happens, vascular permeability increases, so endothelial space increases, and the proteins escape through it, right? Protein rich fluid. However, we will see that again in the mechanism. So that is a definition of exudate. Whereas transudate, it is a protein poor fluid which is formed due to imbalance of hydrostatic and oncotic pressures with normal vascular permeability. Now, what is hydrostatic pressure and what is oncotic pressure? Now, hydrostatic pressure is a pressure that is exerted by the fluid on the vessel wall. So basically it is a kind of pressure which takes the fluid away from the vessel wall, whereas oncotic pressure, it is the osmotic pressure exerted by the albumin on vessel. So basically that brings the fluid inside the vessel. Wherever the oncotic pressure is high, fluid moves there, right? So that is basically the definitions of exudate and transudate. You have to keep in the mind about the protein content. Then write the cause. Exudate, it is seen in inflammatory conditions, for example infection, inflammation and malignancy, whereas the transudate, it is seen in non-inflammatory conditions, example is heart failure, nephrotic syndrome and cirrhosis. Then write about the appearance. Now exudate, it appears like cloudy or turbid. Okay, it may be purulent. Purulent, I mean pus, it is usually seen when there is some bacterial infection, or it may be chylous. Now chylous is something, it is seen when there is dissolved fat. It will be like a milky white condition, and it can also be hemorrhagic, where it is a reddish appearance, right? So this all appearances is due to proteins and cells. Now coming to the transudate appearance, it appears clear and serous because it lacks cell and fibrin and it looks watery. Then mechanism of exudate, we discussed this even in the starting of the video itself, that vasodilation, then vascular permeability, endothelial cell junction widen, so the fluid escapes along with plasma proteins, fibrin. That's why it is a protein rich fluid. Whereas transudate mechanism, what happens? It happens due to ultrafiltration of plasma, which is caused due to increased hydrostatic pressure or decreased plasma oncotic pressure. If hydrostatic pressure increases, it goes out. Again, decreased plasma oncotic pressure, it goes out. So that is how it happens. However, here the vascular permeability is normal. Then color. Now color, exudate color varies from yellow to red, which depends upon the type of inflammation and presence of RBCs or pus. Whereas transudate color, it is usually straw yellow, which is due to absence of blood and inflammatory cells. Now coming to the protein content, exudate, obviously it has high protein concentration greater than 2 gram per deciliter, and it contains albumins, globulins, fibrinogen, etc., and due to increased vascular permeability. Whereas transudate, it has low protein concentration, less than 2 gram per deciliter, and mainly contains albumin, and protein loss is minimal. Then about fibrin content and clot formation, exudate, it has high fibrin content. Obviously fibrin is one of the proteins found in plasma, so if protein is high, fibrin is high, so fibrinogen leaks out and gets converted to fibrin and hence clots spontaneously. Whereas in transudate, protein content is low, so fibrin is low, so it does not coagulate. Then coming to the character of edema. Now edema, there is two types, non-pitting type and pitting type. What is basically non-pitting and pitting? So when you put pressure or press there with your finger in the swelling, if a pit is formed, it is known as pitting edema, and if pit is not formed, it is known as non-pitting. Now why the pit is formed? It is because when the protein content is low, then the fluid can easily move. So when the pressure is applied, fluid moves away because of less protein content. That's why pit is formed, pitting edema is formed. Whereas if protein is high in that fluid, then even if you apply the pressure, that protein prevents the fluid from moving. So there is no pit is formed, so that is non-pitting edema. Now consider the case where protein is high. The protein is high in exudate. So in exudate it is non-pitting edema. Whereas in transudate protein content is low, so pit can be formed, so it is pitting edema. That's all. And coming to the cell count. Now exudate, it has high cell count, mainly inflammatory cells, because obviously exudate is seen in inflammatory conditions, so obviously their cells will be there. Whereas in transudate it is low cell count and few or no inflammatory cells. Coming to the specific gravity. Now again, what is specific gravity? It is basically the ratio of density of fluid to the density of water. Now we all know from our basic mathematics that density is mass by volume. So wherever which fluid mass is high, its density will be high. Now if protein is present, then obviously mass is more, so there is more specific gravity, and if protein is not present, mass is less, so there is less specific gravity. So exudate, it has high specific gravity because of high protein content, and transudate, it has low specific gravity due to low protein content, and line of demarcation or value of demarcation here is 1.018. So exudate has greater than 1.018, whereas transudate it has less than 1.018. And coming to the type of cells. Now exudate, it contains numerous inflammatory cells, and you know in acute inflammation it will be neutrophils, whereas in the chronic inflammation it will be lymphocytes. So presence of cells indicate active inflammatory response. Coming to the transudate, it contains few or no cells, may have occasional lymphocytes or mesothelial cells, and absence of inflammatory cells reflects non-inflammatory process. Next, about bacteria. Now exudate, obviously it is seen in inflammatory conditions, so bacteria may be present. If the infection is present, or if the inflammation is because of the infection, obviously bacteria will be present. So it supports diagnosis of infectious pathology. Transudate bacteria are absent because obviously if bacteria are present, then 100% there will be inflammation. So this is not produced during inflammation, so transudate bacteria are absent as there is no inflammation or infection. Then lactate dehydrogenase, you know it is a selective marker, or it is an enzyme, right? So exudate LDH level is high. Why? Because there is increased cell breakdown, so it is released from inflammatory cells and damaged tissues. Whereas transudate LDH level is low because there is minimum cellular content and there is no tissue injury. If you remember here, the main problem is difference in hydrostatic pressure or oncotic pressure, right? So vascular permeability remains normal in transudate. Okay, so examples for exudate, it is pus or inflammatory effusions, whereas for transudate it is congestive cardiac failure, nephrotic syndrome, or liver cirrhosis. And yeah, that's all. It's pretty what to say, it's easier if you just think it and apply a proper logic, then you can write it easily. Now you put the tabular column, whatever point we discussed, you just mention characteristic, exudate and transudate. So one more trick to remember, you don't need to remember how it differs from exudate and transudate, you can just read and analyze it, put logic, you can write it. The trick here is you have to remember the characteristics, you have to remember what all the points you have to mention, and for that we have a mnemonic. It is GF blame C4, or C to the power 4 up. Now you all know GF, it is a very popular word in the graduation time, right? And pay, it is like in Hindi you say, right, us pay and all that. So GF पे blame, हमेशा GF पे blame डालते रहते, तो it is GF पे blame C to the power 4. So G stands for gravity, F is for fibrin content, P is for protein content, E is for edema, and B is for bacteria, L lactate dehydrogenase, A appearance, M mechanism, E example, and C to the power 4 is cause, color, cell count, and cell type. So if you write this much, it's more than sufficient, and examiner will be very happy and you will be getting the marks you deserve. So that's all for this video. I hope it was helpful for you. If it was helpful, like, comment, and do subscribe if you haven't, and share so that other people also will get benefited. So that's all for today. Thank you very much. Keep studying. Do well. All the best. Thank you.